My name is Dr. Heather Moore. I am Total Performance Physical Therapy. Tonight we're going to talk about hip physical therapy. So this means a lot of different things. Could mean a pain in your butt, could be hip pain, could be low back pain. A lot of people have hip pain, but it's coming from their low back, or maybe it's coming from their hamstring. But it's really always important when you're talking about the hip that you're looking at the back, that you're looking at the hip, that you're looking at the hamstring, the knee, because most oftentimes it's not just a hip problem. So as you know, I usually will tell you, looking above and below the joint is really important when it comes to addressing any sort of physical therapy, but hip especially, because that's connecting the back and the legs and things like that. So a lot of times with hips, there's a couple things that you can do to see kind of the health of your hip and how healthy your hip is. So the first one I'm going to show you is just being able to sit in a cross-leg position and put your foot over your knee. So a lot of people will have to do this in order to do that, okay? That's a sign of some hips that require physical therapy. But you should be able to rest your ankle on your knee. Your knee should go almost parallel to the floor, just like this, all right? You should sit up straight. Now, if you slouch down, you're going to get different results. So you want to make sure that you're sitting up nice and straight, and you're going to check out how your hip looks. Now, a lot of times this is how they look, all right? This is not good, all right? That means there is, unless you have a hip socket deformity, which you would know if you did by now, probably by the time you're my age, a hip like this is actually going to lead to a lot of problems. So if this is how you look, or if you can't even lift your leg up without helping yourself or helping your leg up, that's an indication of a problem that is ready to kind of explode. And it could come in the form of sciatica, it could come in the form of low back pain, it could come in the form of hip pain. So if you have a hip like this, if you have low back pain, chances are it's coming from this tightness. So, and as always, you want to compare sides. So, you want to make sure that you're able, and as you can see, actually this side's a little bit tighter. If you see this leg goes up a little bit more. Wouldn't really call this a dysfunction or be worried about this, but I know it's tighter and I can feel it. Now again, I did just compete for an hour and a half yesterday, so I am a little bit tight. I have been rolling, but sometimes that doesn't always work. So you want to always make sure that you check both sides of any type of comparison that you're doing. But the main thing is, one, that you're able to lift your foot, put it on top of your knee with no problem. You don't want to have to assist that. And the second is, after you sit up straight, where does your knee land? If it's up here, that's a sign of a problem. Or if you have to do this, that's a sign of a problem. So one of the things you can do actually is just take this right into a stretch. So if you find, even if you're like this, all right, you can take this right into a stretch. Now, some of you may be sitting here and feeling a stretch like this, and that's okay. That's fine. Let gravity do its work. What you don't want to do is you don't want to crank your hip down and really try and force a stretch, okay? First of all, I'm contorting my back to do this. I'm actually not really getting the stretch where I need to get the stretch. I am not allowing the stretch to occur in this spot that it needs to. So if you need to hold your foot here, that's okay. The main thing is you want to make sure you're sitting up nice and straight. This, slouching down, is a totally different stretch. It's actually going to hurt your low back, herniate some discs. So you're going to sit up nice and straight. Now, if you're able to hold your foot like this without any assistance, great. If you need help, fine. Nice and straight, and then you're going to lean forward. Now, you can feel this stretch either in the glute, in the hip, in the back of the leg, in the side of the leg, depending on where you're tightest, is going to depend on where you feel this stretch. So it is not uncommon to feel this in a bunch of different places, and one day you may feel it in a different place than the next day. That's okay. You don't want to feel pain, and you don't want to feel numbness and tingling. So when you sit up nice and straight and you lean forward, that's where the stretch ends, okay? And then you're going to switch legs. Now you can do this while you're sitting at work, and what you can do is you can actually, if you're able to leave your leg there, you can let gravity do the work. So you can sit here for a couple of minutes and just kind of let gravity open up your hip, all right? So you don't want to sit here all day like this, because then you're going to have other problems in another direction. But this is totally fine to be sitting like this. Another thing you can do is, if you find that you're having specific hip pain or pain in the butt, you can take a ball. Here we use a Beastie ball, but you take a tennis ball and you can put it right underneath that spot that's sore in your hip, and you can kind of rub it around, loosening up that tight spot. People always ask, is it okay to drive with one there? For 5 minutes, yes. For 3 hours, no. You don't want to do that. You want to just kind of make sure that you rub out the knot that's in there and work that out. Now, the hips being tight is a major issue when it comes to low back pain and when it comes to knee pain. Tight and weak hips lead to a lot of problems. So the next thing I'm going to show you is a strengthening exercise. So what you want to do is you're going to start just with your feet level, put your hands on your hips, and all you're going to do, shift your weight to one side, and then you're just going to hike your hip up, okay? This knee does not bend nor straighten, all right? So just lift your hip off the ground. This is not a big movement, all right? It's nice and slow, and it's, now when you get really good, you can actually not put your foot all the way down, all right? You're going to feel it working in the standing leg. You're not really going to feel much going on in this leg. But what that's going to do is that's going to start to strengthen your hips. And because the hip, especially the glute medius, is so important when it comes to knee pain and foot pain, it's really important that you strengthen your hips. So all you're going to do, again, is just subtly lift your foot off the ground, moving your hips. A lot of times people want to do this. It is not anything to do with your upper body. It is just your hips. And if you have problems doing this, that's an indication that there's a lot of tightness in your hips, and you do need to get that looked at and worked on, because this should be pretty easy. You want to do about 3 sets of 30 on each side, all right, to make sure that those hips start to open up, those hips start to strengthen. It's important to stretch and strengthen the hips. A lot of times people think that when you are having pain, the only thing you want to do is to stretch it out. A lot of times that may be the case, but it's also important to strengthen it, and especially this type of a little glute medius muscle in your hip that doesn't get a whole lot of attention with any other exercise besides a few specific ones. Even if you're an avid runner, if you don't do specific glute medius strengthening, you're going to have some hip problems. If you have problems with your hips or have hip pain or back pain and you want a doctor of physical therapy to take a look at it, we offer a free consultation. All you have to do is call our office at 215-997-9898 and we'll take a look.